Welcome to Outbreak Brief, the podcast that takes you inside the world's most dangerous infections. A germ that takes a coin flip on your life with an average 50% fatality rate has just triggered a 2026 international health emergency.
It's definitely a terrifying situation right now.
Yeah, it really is. Let's drop right into May 2026. The Democratic Republic of the Congo and Uganda are currently facing a massive epidemic. We're doing a deep dive into the reports on this Bundibugyo virus, but there's a huge open question here that we need to answer today.
Right, the mystery of how it lingers.
Exactly. How can a virus that you have successfully fought off, like you survived it, your blood is clear, secretly hide inside your body for over a year, just waiting to strike someone else?
It's wild, right? But to unpack how it pulls that off, we first need to look at what this germ actually is.
Okay, so what are we dealing with here?
So Bundibugyo isn't just a single standalone germ. It's part of the Ebola virus family, which, we've actually known about since 1976 when it was first found near the Ebola River.
So it's like a family of burglars, basically.
That's a great way to put it. Yeah, a family of burglars. And each one, Ebola, Sudan, Bundibugyo, they each use a slightly different crowbar to break into your system.
Right, but how does this specific burglar actually get inside your house, so to speak?
Well, it definitely doesn't float in the air.
Oh, thank goodness.
Yeah, huge relief. It basically hitchhikes. It needs a ride to get from person to person.
Hitchhikes on what?
On bodily fluids, we're talking blood, sweat, vomit, or even on infected wild animals like fruit bats.
Okay, so this isn't like catching a cold from an air vent on a crowded bus. You must physically get infected fluids into, say, a scratch on your skin.
Precisely. The virus is actually super fragile on dry surfaces. It needs that wet bridge to cross over.
Wow, okay. But with transmission requiring such incredibly close contact, who is actually in the crosshairs right now?
Well, the good news for the average listener is that you're likely perfectly safe. You actually cannot spread it before showing signs of being sick.
That's a really important point to highlight. You have to be actively sick to be contagious.
Exactly.
Yeah.
So the genuine risk falls heavily on people who are, well, showing compassion.
Wait, what do you mean by that?
I mean, frontline healthcare workers, people caring for sick relatives at home, or folks participating in traditional burial ceremonies where they touch the deceased.
Oh, wow. So it actively punishes people for caring for their loved ones.
It really does. It's a tragic part of how this germ operates.
That is heartbreaking. But if you are in a risk zone, there is a specific shield you can use, right? What can people actually do to protect themselves?
There are a few very concrete things you can do today. First, avoid contact with wild bats or monkeys completely.
Just stay away from them.
Definitely. And absolutely avoid eating their raw meat. Second, practice strict hand hygiene. Wash your hands constantly.
Simple but effective. And, there's a vaccine recommendation we should mention, too. If you are facing the specific Ebola virus strain, request the Ervebo vaccine. It's highly recommended for frontline workers.
Yes, exactly. The Ervebo vaccine is a lifesaver for that specific strain. But remember, the Bundibugyo virus uses a different crowbar, so to speak, which is why we're in this emergency now.
Right, the vaccine doesn't quite fit the lock. But let's say someone does get sick with Bundibugyo and they beat it. They survive. What happens after you beat the virus?
This is the part that most people don't know, and it's honestly shocking. The virus can persist in the body. It retreats into what we call immune-privileged sites.
Immune privilege, like VIP sections of the body.
Basically, yeah. Places like the inside of the eyes, the brain, and the testicles.
Wait, really? It just camps out there?
Yeah, it does. And because it hides there, it can actually be transmitted via semen up to 15 months after clinical recovery.
15 months? That's well over a year later.
It is. Which brings us back to that question you asked at the very beginning.
Yeah.
How does it do this?
Right. How can it hide for that long without the immune system just wiping it out?
Well, our immune system's weapons, like severe inflammation, they cause a lot of collateral damage. If your white blood cells rush into your eyes to fight a virus, the swelling would permanently blind you.
Oh, I see. So your body's own protective sanctuaries for sensitive organs accidentally act as a perfect hideout.
Exactly. To protect your vision or your reproductive organs, the body intentionally locks the immune system out of those delicate zones. And that allows the virus to evade the immune system long after the survivor's blood is totally clear.
That is just wild. We lock out our own defenses to protect our most sensitive tissues, and we just accidentally build a safe house for our deadliest pathogens.
It completely changes how we define the end of an outbreak, that's for sure.
It really does. It leaves you wondering, when we think we're totally cured of a bad virus, are we actually clear, or is it just hiding in the VIP lounge? Something to mull over next time you catch a bug. Stay informed. Stay prepared. This has been Outbreak Brief.